Hello guys, hi everyone, good evening, hope you're all doing well. Yeah guys, I'm going home from work and it's almost dark, and I decided let me talk about Afya because today I realized it's a big challenge to parents and also some students. So some of you are still not aware of what Afya is and what it covers. Yeah, so welcome back to my YouTube channel, and thank you so much for those who have subscribed. Guys, if you know that you're there, you're watching and you haven't subscribed, kindly subscribe, give this video a like, share to as many people as possible. Yeah, and also don't forget to comment down below and to give this video a notification bell so that every time I upload a new video, you will be the first one to be notified. So guys, let's talk about Afya. Some of you call it Nemis number, others UPI, whichever name, it's okay. One thing, Afya, it's a comprehensive scheme cover that is given to all students in secondary schools and also all students in junior secondary. But in junior secondary, I think it's for the public students, because in private, if your child is in private school, I won't talk much about private because I haven't seen any for private, but I've seen several for public junior secondary. And guys, maybe it's because those in private, their parents can be able to pay for their bills. I don't know. Yeah, so it's a medical cover that is given to the students in high school. It's a comprehensive cover. Comprehensive meaning that it can cover everything, all the services that a student need, all the quality health services that your child will require. And it was arranged at least to ease the burden from the parents or the guardians. And like I said, it covers everything, all the specialized outpatient services and also for the inpatient services. For the outpatient services, it covers renal, that is the dialysis. It also covers radiology, for example, all the x-rays, all the CT scan, MRI, and the ultrasound. It covers all that. It also covers chronic diseases, for example, cancer, the chemotherapy and all. So it's a good cover. And if you know that your child doesn't have one, I think you should make an effort to know the reason, because it doesn't require much. It's given to students immediately they are admitted in high school. The only document you are told to submit, that is the original birth certificate, IDs from both parents. If you are one, you just submit one ID, and also parents' contact, and that's all. I don't think there is any other document that is needed. And after that, their names are put in database management of Ministry Education, and then After everything, they're submitted to the NHIF for registration. Yeah, that's all. I don't think there is much done. So if you know that your child has no birth certificate, you need to make an effort to submit one so that your child can also get the benefits from that, because it's for the duration of their study, that is from Form 1 to Form 4. And I've also seen some of the students, as they repeat classes, or maybe as they come back from after they are finished Form 4 and they repeat, they are put back in the system. So you don't have to struggle. You don't have to struggle to get money to take your children to the hospital and to pay the bills, because it's covered. The government have made an effort to cater for that. All that you need is for maybe it's the school fees and for other caution. That is caution money. Yeah. And like I said, guys, there's some parents who bring their children to the hospital, and when they are asked to produce that, then they don't even know what is that. Some of the students don't even know what is that. So I would advise, if you know that you're there, you are a parent, you have a child in high school or maybe in junior secondary, you can go ask the headmaster or the headmistress or the secretary. Just ask for it. You can even be printed. They can even print one for you, so that you can be doing photocopies. You know, sometimes your child can get sick while they're in holidays at home, and you can take them to any hospital using that. Because you see, sometimes you get to see that there are some students who only use the cover only when they're in school, but when they go for holidays and maybe they have forgotten to cram the number, the Nemis number, they have no choice. Sometimes you try calling the school and there is no one to pick. So I'll say, when you're taking your children back to school, just ask for one. There are some students who are even given the smart card. There are some schools that are very, very, very good at looking for taking care of their students. And if they don't have the smart card, you can get that printing paper. I wish I had one. I would have shown you the example, but if you have any question, or maybe if you want to know to see it or to know about it, just comment below, or maybe reach me, like I said, through my email. That is wnyambura79@gmail.com. You can reach me through that. Yeah, and I don't think there is much to say about Afya. All I can say is that it's a good cover. Parents, it's a good cover, so you should get one, especially if you know that you are self-employed and you're the one who gets to pay for your NHIF cover, because that the services that Afya gives, it cannot be compared with the services that you will get when you have self-employed NHIF cover. I don't know if I'm right. Yeah. And also for the civil servant, even if you are employed by the government, you know, sometimes you find that there are so many family members going through challenges with their health, and they get to exhaust their outpatient money. So if you know that you have exhausted, you can also and you have a child in high school, you should also note that it's a good cover. From now on, be using that. Yeah, so it's up to you if you let your child get a good and quality health services when they go to when they visit the hospital, or if you want to get money from your pocket and pay for your bills. I don't think there is anything else to add. So if you have any question and any idea or any experience about it, you can just share it with other people in the comment section. And if you feel like there is something else that I have left, you can add. Yeah, let's meet again in our next video. Bye guys. I'm almost halfway. Yeah, I'm almost halfway. I'm in Thika Road. It's getting dark. Actually, it's almost 7 o'clock. Yeah, but I'll still get home. I know I'll get home safely. Yeah, and that's all. Let's meet again in our next video. And guys, kindly support me, kindly subscribe. I know maybe most of you love entertaining videos, but yeah, but you see, this one, it's all about it's all about learning. And I'm very sure, because I'm working in a hospital, I know. And the reason I came up with this idea is because I've seen how so many of you are struggling, how so many of you are, let me say, they're struggling so much. And that's why I came up with this idea. That's why I came up with this content. So guys, you're welcome. Kindly subscribe, kindly share my channel, because I have a lot of ideas, and so much is coming. Yeah, bye.